Have you ever heard of granulated eyelids or blepharitis? Well, it's a common condition that affects the eyelids and is prevalent in both adults and children. Essentially, blepharitis is an inflammation and sometimes an infection of the eyelids and lashes. It holds the title of being the most common complication of ocular rosacea, a condition that affects the eyes. The influence of blepharitis varies from person to person, depending on the type of blepharitis they have. There are two main types, anterior blepharitis and posterior blepharitis. Anterior blepharitis affects the outside of the eyelid and eyelashes. It's like having an unwanted guest on the exterior of your eyelid, causing discomfort and sometimes even pain. Now, imagine having a party inside your eyelid. That's what posterior blepharitis is like. It affects the Meibomian or oil glands of the eyelid, causing a ruckus in a place where you least expect it. These conditions may sound scary, but they are more common than you think. The seriousness of the condition varies, but rest assured, understanding the causes and symptoms can help manage the condition effectively. Anterior blepharitis can be triggered by several factors, including poor hygiene, seborrheic dermatitis, acne rosacea, allergic reactions to chemicals, and even an eyelash mite called Demodex. The latter tends to stick around and increase in number as we age, turning our eyelids into their personal playground. When blepharitis becomes chronic, it can cause the eyelids to appear red, thicker, and roughened, giving them a granulated appearance. Although this can occur in children, it's more common in elderly patients and those who have ocular rosacea. On the other hand, posterior blepharitis refers to Meibomian gland dysfunction, a problem that can lead to evaporative dry eye syndrome and granulated eyelids. People with this condition often have eyelids that appear thickened, swollen, and usually have a red-rimmed appearance. Understanding the causes of blepharitis is the first step in managing this condition. So, what causes this inflammation or infection on our eyelids? Well, let's dive into the causes of anterior blepharitis. First up, poor hygiene. Our eyelids, like any other part of our body, are home to bacteria. When the bacterial load begins to grow, it can collect in the crevices and folds on our eyelids. If our hygiene is not up to par, the bacteria multiply, leading to inflammation, redness, and that flaky or crusty discharge we often associate with blepharitis. This is particularly common in children and teens, who may have yet to develop a thorough cleansing routine. Next, we have seborrheic dermatitis and acne rosacea, skin conditions that can contribute to the onset of blepharitis. Seborrheic dermatitis is a type of skin inflammation that primarily affects the scalp and face, resulting in flaky, scaly skin. Acne rosacea, on the other hand, is a chronic skin condition that causes redness and visible blood vessels in the face. Both these conditions can trigger inflammation in the eyelids. Allergic reactions to chemicals are also a potent cause. The skin around our eyes is sensitive and can react adversely to certain substances, such as makeup, facial cleansers, or even airborne allergens. This reaction can lead to inflammation and, subsequently, blepharitis. Lastly, we have an unusual but significant culprit, eyelash mites, specifically a type known as Demodex. These microscopic creatures infest the eyelid margins and eyelashes. As we age, Demodex tends to stick around a bit longer and multiply, increasing the risk of anterior blepharitis. Now, before you panic at the thought of eyelash mites, remember, good hygiene can keep these causes at bay. Regular thorough cleaning of the eyelids and lashes can help control bacterial growth and mite populations, reducing the risk of blepharitis. And if you have seborrheic dermatitis or acne rosacea, managing these conditions can also help prevent blepharitis. While anterior blepharitis can affect anyone, it is more common in children and teens. So let's all remember to keep those eyelids clean and healthy. But how do we identify blepharitis? What are its symptoms? The symptoms of chronic blepharitis are often quite noticeable and can significantly affect a person's quality of life. The most common symptom is redness of the eyelids. This is due to the inflammation that occurs when the eyelid's delicate skin is irritated by bacteria or other factors. This redness can make the white part of the eye look bloodshot and can cause discomfort. Another symptom of chronic blepharitis is a thickening and roughening of the eyelid skin. This happens as the body tries to protect itself from the constant irritation. The eyelid may become so thickened that it feels hard to the touch and may even be visibly altered in shape. The eyelids can also take on a granulated appearance. This is due to the small, hard lumps that form as the inflammation progresses. These lumps are actually tiny collections of immune cells that the body sends to the area to fight the inflammation. They can be quite noticeable and can even cause the eyelashes to fall out, leading to further discomfort and cosmetic concerns. Chronic blepharitis is more common in elderly patients and patients who have ocular rosacea. This is because the immune system's ability to fight off bacteria and other irritants decreases with age, and ocular rosacea can cause additional inflammation and irritation. In addition to the visible symptoms, chronic blepharitis can cause a range of uncomfortable sensations. Patients may experience a burning or stinging sensation, a feeling of grittiness as if there's sand in the eyes, and sensitivity to light. These symptoms can be particularly bothersome and can interfere with daily activities such as reading, using a computer, or even just enjoying a sunny day outdoors. It's important to note that while these symptoms can be quite distressing, they are not usually a sign of a more serious underlying condition. However, chronic blepharitis can lead to complications such as damage to the cornea if left untreated, so it's important to seek medical attention if you're experiencing these symptoms. Recognizing these symptoms is crucial for early diagnosis and treatment of blepharitis. Now, let's turn our attention to posterior blepharitis and Meibomian gland dysfunction. Posterior blepharitis is another type of this condition that specifically involves the Meibomian glands. These glands are located in the eyelids and play a crucial role in the health of our eyes. They secrete an oil that contributes to the stability and quality of our tears. This oily layer is essential because it prevents our tears from evaporating too quickly. In a case of posterior blepharitis, these Meibomian glands are affected, which can lead to what's known as evaporative dry eye syndrome. This is where the tears dry up too quickly due to a lack of the oily layer, resulting in dry and often irritated eyes. It's a common issue faced by those who suffer from this type of blepharitis. Furthermore, this dysfunction in the Meibomian glands can also lead to the development of granulated eyelids. This is a condition where the eyelids appear thickened and swollen, usually with a red-rimmed appearance. They may also develop oily, waxy caps along the eyelid margin, which can be uncomfortable and can further exacerbate the dry eye syndrome. It's important to note that posterior blepharitis and Meibomian gland dysfunction are not always isolated issues. They often occur in conjunction with other eye conditions or as a result of underlying health issues. For instance, people with ocular rosacea, a condition that causes redness and inflammation in the eyes, are more prone to experiencing posterior blepharitis. Furthermore, certain lifestyle factors can also contribute to the development of this condition. For instance, wearing makeup and not thoroughly removing it at the end of the day can clog the Meibomian glands, leading to dysfunction and posterior blepharitis. In conclusion, posterior blepharitis is a condition that affects the inner eyelid and the Meibomian glands. It can lead to evaporative dry eye syndrome and granulated eyelids, causing discomfort and often requiring treatment to manage the symptoms. This type of blepharitis often results in thickened, swollen eyelids with a red-rimmed appearance. You might wonder who is at risk of developing blepharitis. As with any health concern, understanding the risk factors is crucial. There are several factors that can increase your likelihood of developing this common eye condition. Firstly, dandruff. Yes, the same flakes that can dust your shoulders can also contribute to blepharitis. Dandruff, or seborrheic dermatitis, can affect the eyelids, leading to inflammation and discomfort. Next, we have dry eyes. This may seem counterintuitive, but those with dry eyes are at a higher risk of developing blepharitis. The lack of adequate tear production can disrupt the natural cleaning process of the eyes, creating a conducive environment for inflammation. Moving on, oily skin is another risk factor. Excessive oil production can clog the Meibomian glands in your eyelids. resulting in what's known as posterior blepharitis. This is a type of blepharitis that affects the inner part of your eyelids where the oil glands are located. Speaking of oil glands, let's talk about Meibomianitis. This is a condition in which the Meibomian glands in your eyelids become inflamed. Just like with oily skin, this can lead to posterior blepharitis. Finally, and perhaps most importantly, is poor eyelid hygiene. This is a significant risk factor, especially for anterior blepharitis, which affects the outside front edge of your eyelids. Poor eyelid hygiene allows bacteria to grow and proliferate, leading to inflammation and possible infection. So if you have dandruff, dry eyes, oily skin, Meibomianitis, or if you're not diligent about keeping your eyelids clean, you could be at risk of developing blepharitis. And remember, this condition is not age-specific. Both adults and children can develop blepharitis. However, the good news is that understanding these risk factors can empower you to take preventive measures. By addressing these risk factors, you can protect your eyes and maintain their health. So, keep your eyelids clean, manage any skin conditions, and ensure your eyes are well lubricated. Understanding these risk factors can help in preventing the onset of blepharitis. So, how do we treat this common eye condition known as blepharitis? This is a question many of you might be asking yourselves right now, so let's dive into it. The treatment for granulated eyelids, or blepharitis, encompasses a variety of remedies. The most common method includes the application of very warm compresses to the eyelids. This simple action not only brings comfort to those suffering from blepharitis, but it also increases blood flow to the area, accelerating healing. Additionally, the warmth can physically melt the hardened or impacted eyelid glands, providing relief from discomfort. Warm compresses are generally beneficial in reducing itchiness and pain as well. Moving on, many healthcare providers prescribe steroid eye drops to alleviate the symptoms of blepharitis, such as redness and irritation. These drops are designed to reduce inflammation and provide quick relief. Additionally, over-the-counter eye drops, commonly known as artificial tears, can be recommended. These drops replenish the moisture in your eyes and can help manage dryness and discomfort associated with blepharitis. Eyelid scrubs are another beneficial treatment option. These gentle pre-moistened pads or solutions are used to clean the eyelid area, removing debris and reducing bacterial growth, which can lead to blepharitis. Now, let's talk about antibiotic ointments. These are particularly helpful in cases where blepharitis is caused or worsened by bacterial infection. Some commonly prescribed ointments include osutracin and imicin. These ointments work by killing the bacteria causing the inflammation. For those dealing with Demodex blepharitis, caused by an eyelash mite, antiparasitic eye drops like Xdemvy can be prescribed. In certain stubborn cases, when the condition persists, oral antibiotic pills may be prescribed for anywhere from a week to several months. Do remember, these treatments aim to manage and alleviate symptoms. However, every individual is unique, and so is their condition. Therefore, it's crucial to consult with a healthcare provider to determine the right treatment plan tailored to your specific needs and symptoms. While these treatments can alleviate symptoms, it's important to consult with a healthcare provider for the right treatment plan. Blepharitis, while common, is often misunderstood. This is where we began our journey, and as we approach the conclusion, let's take a moment to revisit the key points we've explored in this video. Blepharitis, often referred to as granulated eyelids, is an inflammation and sometimes an infection of the eyelids and lashes. It's a common problem, affecting both adults and children, and is often the most common complication of ocular rosacea. We've discussed that there are two types of blepharitis, anterior and posterior. The anterior type affects the outside of the eyelid and eyelashes, often caused by factors like poor hygiene, seborrheic dermatitis, acne rosacea, allergic reactions, or even the presence of the eyelash mite, Demodex. When blepharitis becomes chronic, the eyelids take on a red, thickened and roughened appearance, more granulated you could say. This is more common in elderly patients and those with ocular rosacea. Posterior blepharitis, on the other hand, is related to the dysfunction of the meibomian or oil glands of the eyelid. These glands secrete a type of oil that contributes to the stability and quality of your tears. Without this oily layer, your tears evaporate quickly, leading to evaporative dry eye syndrome, another factor contributing to granulated eyelids. We've also touched on the risk factors for blepharitis. It's one of the most common eye conditions, with over 40% of those visiting an eye care provider having symptoms of blepharitis. Factors such as dandruff, dry eyes, oily skin, and meibomianitis, a disorder of the oil glands in your eyelids, increase your risk of developing this condition. Keeping your eyelids clean is a simple, yet effective way to reduce your risk. The treatment of granulated eyelids encompasses various remedies. Warm compresses, for instance, can reduce signs and symptoms, bringing comfort to the patient, speeding up healing, and melting the hardened or impacted eyelid glands. Steroid eye drops, over-the-counter eye drops known as artificial tears, and eyelid scrubs are also commonly prescribed. Antibiotic ointments and antiparasitic eye drops can be beneficial, especially in cases of Demodex blepharitis. In stubborn cases, oral antibiotic pills are prescribed. While we've covered a lot of ground, remember that this is just a surface-level exploration of blepharitis. There's so much more to know and understand about this condition, but we hope this has provided a solid starting point. Remember, early recognition and treatment can help manage this condition effectively. Always consult a healthcare provider if you suspect you have blepharitis, because when it comes to our health, especially something as precious as our sight, awareness and timely action can make all the difference.